Hi, I'm Taylor, and today we're talking about tuberculosis. So first off, we have what is the difference between latent and active tuberculosis. The difference between latent and active tuberculosis is that latent is hard to find. It is in your system, but it is not actively replicating at the time. You are asymptomatic, and the majority of people with tuberculosis are usually 9 out of 10 latent. It's really hard to find in basic testing because it hides in places you wouldn't think it's at. So it's hard to see, it's kind of hard to treat, and again, during this time, there is no active replicating of the bacteria. It's just in your system, hanging out and using some of your resources. If there is a little flare-up of it, your immune system usually takes control of it and is able to fight it off, and it just goes back into hiding. Some people, it can last their whole life and they may not even know about it, or they find out later in life and they have to get on medicine for it. But latent TB can be your whole life, and sometimes people don't even know it. Active TB is different in the sense that the bacteria is currently multiplying and you can spread it very easily. Most people who have tuberculosis need to be in some type of isolation. An active form need to be in isolation because it spreads so easily. And it also depends on the type of active tuberculosis you have going on. Some are resistant to drugs and some are treatable. But either way, you do have to be isolated and you will have symptoms. Our next question is it harder to treat in latent form and why? I would say yes, it's harder to treat in latent form because you don't know where it is. It's missed often. So a lot of times it's hard to treat because you don't know where it is, you don't know what's going on, you don't know why someone's feeling this way, and then it turns out to be tuberculosis, or it's hiding and your immune system takes control and you have to treat the symptoms or treat as the flares occur. Whereas active TB, I think, is hard to treat as well because you have to take drugs for so long for it. But some drugs are just resistant, or some tuberculosis is just resistant to drugs. So that is a whole other ballgame that is very difficult to handle as well. Now we have an ethical question. Should non-compliant patients be forced into hospital confinement until the treatment is proved to be effective? Sadly, I think yes. Only because you're looking out for a whole population, and if it is the form that is extremely drug resistant, then you're just going to have a whole population of highly contagious people spreading something that we do not have a drug for, and that can have a lot of issues in the population because we don't have any way to make it better. So I do think if you test positive for a form of drug resistant tuberculosis, you should be contained until some type of treatment proves, or until it goes into a latent form if possible. I actually did notice this with my brother. His was not drug resistant. He was, I don't remember what medicines he had, but he had like 2, and he was blocked off for 2 months until they figured out the treatment was working, and blocked off the air vents, like everything in the hospital, and we all had to get tested for like months after that. I probably have latent, in all honesty. I hope not, but yeah. So this is really interesting, and I hope this was informative. Thank you.